flexible, and sustainable investment. I really commend Honorable Ministers for your 2022 commitment to increase assessed contribution to 50% by 2030, and for reaffirming the Abuja Declaration of 2021. To step up domestic financing, including through blended financing, private-public partnership, and solidarity levies. My third priority is enhancing emergency preparedness to build a resilient health system and foster cross-border collaboration. My fourth priority is advancing maternal and child health as well as nutrition. Africa bears a disproportionate share of global health challenges. 70% of the maternal deaths in our continent, 56% of the death of under fives, and a stunting rate of 30%, well above the global one of 22. Despite the daunting figures, I believe we can turn the tide. For instance, in Tanzania, under President Samia's leadership, we have achieved 80% reduction in maternal mortality, from 556 to 104 per every 100,000 live births within 7 years. This remarkable progress was recognized with the 2024 Goalkeepers Award, underscoring the transformative power of primary health care and unwavering political will. My fifth priority is tackling communicable diseases, HIV, AIDS, TB, malaria, and non-communicable diseases, and neglected tropical diseases through a One Health approach, a comprehensive strategy that acknowledges the interconnectedness of human, animal, and the environment. My sixth priority is combating antimicrobial resistance, which causes 1.2 million deaths annually. Alarming, Honorable Ministers, 40% of our member states lack antimicrobial surveillance system database. I'm committed to collaborating with you to establish surveillance database, enhance monitoring, promote responsible antibiotic use, and foster cross-sector collaboration. My seventh priority is strengthening local production of diagnostic, therapeutics, and vaccines. By leveraging the pandemic agreement, engaging our diaspora, enhancing health diplomacy, and sharing expertise. I will also promote research development in traditional medicine, aligning with the WHO Traditional Medicine Strategy 2025-2034. Excellencies, as I conclude, I stand before you not merely as a candidate, but as a dedicated partner, unwavering in my commitment to our shared vision of a healthier, stronger region.
Jacob.
With a proven track record in health leadership and clear vision of continuity, I pledge to serve with integrity and determination. I seek your trust and your vote. Thank you very much.
Thank you, Professor Jacob. We'll now continue with questions and answers. I shall ask the Secretariat to take the board, show everyone that it is empty, and pass it around to collect the name tags. Professor Jacob, you may either remain at the podium or take a seat at the main table. I will draw the first name tag. Equatorial Guinea. Equatorial Guinea, you have the floor.
Thank you very much. I'd like to ask the candidate about what would it be the strategy for small countries and islands in terms of getting more attention, in terms of their support of improving the healthcare system as a whole. The question is coming in relation to sometimes there are confluence of interest in terms of where to put the priority of the little resources that we are managing on the continent, and the approach tend to be prioritizing big countries. But sometimes
Equatorial Guinea, you have
countries
one question.
can be the opportunity to say, okay, so what would you do about securing the support from WHO under your leadership? Thank you.
Thank you, Honorable Minister, for a very important question of small islands. And if I can give examples, maybe we are talking about Seychelles, Mauritius, Comoros. You face unique challenges such as climate change, limited healthcare infrastructures, and vulnerability to health emergencies. So if elected, I will ensure these nations receive a targeted support to address these specific needs. First, I will advocate for tailored strategies like strengthening your health system, improving access to essential medicines. I know small islands depend a lot on imported foods. Unfortunately, these are seasoned foods which come with a lot of salts, increasing NCDs. We'll focus on training and retention of your workers. But the other thing is an innovative method like telemedicine or artificial intelligence, because you can cater with telemedicine, do consultations with neighboring nations while building your workforce and capacity on health or human resources for health. So you have specific needs. We'll make sure that you get preparedness with all the health emergencies, because you are prone to preparedness like any other country. So prepare on surveillance, which has to start now before the emergencies start. We'll assist recognizing the vulnerability to climate change. So I will support development of climate-resistant healthcare infrastructures, build on early warning signs. And lastly, I'll try to prioritize integrating small nations into larger regional health networks, ensuring you have representations during decision-making bodies, because this is where your voice has to be heard and have the data. Thank you.
Thank you, Professor Jacob. We'll now ask South Africa to ask the question.
Thank you very much. So few. Thank you very, very much.